enjoyment of listening to him, inshallah.
Yeah, thanks a lot, Dr. Sarah, for your introduction and for inviting me. Yeah, definitely the pandemic affected us, but thanks for the technology that still keeps us closer to each other. And since the beginning of the pandemic, I was always asking people to keep physical distancing, but also keep social connectedness. So we need to stay together, and we need to stay together even more than before, because the pandemic and this virus hit us at our vulnerability and stay connected with our loved ones. So it's disrupted, I call it the basic layer of human survival. If you remember Maslow's triangle of social needs and psychological needs, the basic needs of the human being are to stay alive, to stay healthy, to have food, to have shelter, and to have people around us. And we cannot function alone because we developed in a way that our self-esteem and our identity, part of it is who do we connect with. And actually, the importance of this social connectedness that was disrupted in this pandemic, COVID-19 pandemic, came up in a very long-term study at Harvard. They studied people since they were born, and I think the people are now at age 60, and they found that the secret of happiness in life that makes us alive and healthy at old age are the sense of gratitude and acceptance, number one, and number two is the strength of social connectedness. Has nothing to do with our wealth, has nothing to do with anything else. The people who have a sense of gratitude and have good, high quality social connectedness are the people who are happy at old age. Now, what did the pandemic do for us? It hit us with an unknown, invisible agent that in the beginning, people did not take it seriously. And then we started seeing people are dying from it right and left. And it hit us our own fear of mortality, fear of death. And I personally lost about 10 people that I know from here and in other countries from the pandemic. And these people, some of them were healthy, were young, many of them were health workers. And we all the people who work on the health field here in this city have seen people dying from COVID-19. And there was unexplained deaths. In the beginning, we tried to understand that certain people have high vulnerability, whether it's age, whether it's underlying illness. And then we found that the virus is hitting people who are very healthy. And it started to hit all of us. And as much as we have a viral pandemic, with that, there is also a mental health pandemic that went with the virus. Not just the virus affected us, and it has mental health complications, which we started to see that a lot. It also disrupted our lives. It kept us alone. It made us afraid to leave our houses. We have to wear masks. We have to wash our hands. We cannot shake hands with people. We cannot hug people. And we found ourselves aware of our own mortality that could come at any moment. And I always talk with my wife about this. Before the pandemic, I was always telling my wife that the best thing, if you want to be happy in your life, you have to live your life one day at a time and be grateful every morning when you wake up that you are alive and breathing. I was saying this even before the pandemic, one day at a time. My wife told me I never understood what you were saying till after COVID-19 pandemic. We now understand what does it mean to live one day at a time. And actually, if something we can learn from this is the best thing to live our life, to understand our life, is to really live one day at a time and be grateful for what you have, what we have. What the pandemic did and affected many societies disrupted not just the health, not just the healthcare system. It also disrupted how we see each other, how we connect with each other. It also disrupted our own sense of vulnerability and displayed it. And now we're all became afraid that not only we may die or end up in a ventilator tomorrow, but also we may lose our jobs. We may not find the food. We saw what happened in the beginning with the empty shelves in the grocery stores. We have seen all of that, and that's expected because human beings are selfish in nature. By the way, there's nothing wrong with that, and we have to accept ourselves. There is a famous book I want people to read. It's the title of the book is called Selfish, Stupid, and Scared. That's the Stop Fighting the Human Nature. The human nature in general, we are selfish, we are stupid, and we are scared. And if we want to deal with people, we have to target these things. We have to target we understand our selfishness, understand our stupidity sometimes, and understand our vulnerability and our anxiety. And the coronavirus clearly displayed these things in the human beings. And I am a psychiatrist, and I have been practicing psychiatry for about close to 30 years now. I practice psychiatry in many countries, and here in America, you see patients from all over the world. So I have seen psychiatric illness across many cultures, many countries, many religions. I have seen all of that, and the pandemic have shown us what can happen when we are hit with our own mortality, and also what can be hit with our incomes. We are vulnerable that we may lose our income, we may lose our jobs, and many people lost their jobs. I have seen a sharp increase in psychiatric admissions in the hospital where I work. We have seen a lot of increase in prescription. Actually, I was looking at the statistics. During this pandemic, there have been a 14% increase in the prescription of antidepressants. There have been an increase in suicide. There have been increase in domestic violence. There have been increase in child abuse. People are staying together at home and there's no outlet. There have been increase in youth depression. There have been increase in substance abuse during this pandemic. So there's definitely a mental health crisis that followed this pandemic, and we all have suffered from it to different degrees. Now, what is the definition of mental health and mental disorders? What does that mean? Is anxiety a mental illness? Is depression a mental illness? Is sadness a mental illness? Is isolation a mental illness? We put some guidelines for that. A mental illness is a mental phenomena that can either result in distress, which is internal distress, or dysfunction, which is an external disruption of your relationship with the world around you. And if you have any mental health phenomena that's causing significant distress and significant impairment in your interaction with the environment around you, with your family, with your neighbors, with the job, with what you're doing in life, that's considered a mental disorder. We have so many varieties of mental disorders that we deal with. By the way, there's no sharp distinction between what's a normal phenomena and what's an abnormal phenomenon. It's on a continuum. And if you reach a point in sadness and depression and loss of pleasure seeking, for example, that it impairs your ability to function, we call this major depressive disorder. Same thing for anxiety. If you start to have symptoms of excessive worrying or physical symptoms or panic attacks, we call this pathological anxiety, or we call it panic disorder, or we call it post-traumatic stress disorder. There have been or obsessive compulsive disorder. There have been a sharp increase in these mental health issues during the pandemic. Why is that? Because the stress was extreme here. It's a stress that hits your vulnerability, hits your basic life instincts. You want to be alive. And because of that, we see an increase in depression, increase in anxiety. People are dying, and people have post-traumatic stress disorder. The patients with pre-existing mental illness, there have been a sharp increase in their symptoms. The people who were in nursing homes who could not see their loved ones, and then we seeing each other on cameras. I got a lot of admissions from the nursing homes because of the pandemic. We have seen a lot of domestic issues within families because people are sitting together at home, stuck at home, and there's no outlet from there. So all of these things had happened, and we see it every day. And by the way, the effect of the pandemic on mental health is not going to go away quickly. And we all have to be aware that mental disorders are illnesses or disorders that has treatment and need to be addressed. The stigma associated with mental illness still there, by the way, and is still there even in this country and in all cultures. And we struggle with that sometimes, that people have suffered with mental illness for many months, sometimes many years, and they are not willing to talk about it. And I have to encourage everybody, if you have significant symptoms or you know somebody with significant symptoms, mental symptoms that's impairing your normal level of functioning, you know how your normal level of functioning, and you see some impairment, some sharp decrease in your level of functioning or your satisfaction of life, or what we call hedonic activities, what you were doing you're unable to do, there may be a simple treatment for that you can take and can change your life. And I see a lot of, I have seen wives and husbands, and I give one of them some treatment for their mental illness, and the other partner comes and thank me for getting their husband back or getting their wives back. And sometimes the treatment is much simpler than you think. If you have depression or anxiety or OCD or post-traumatic stress disorder, there are treatments available. The treatment can be either biological treatment, medications, or psychotherapy. And especially now, there are a lot of evidence-based psychotherapies that can be done. And even during the pandemic, we do it online and we do it on the phone, and it is provided, whether it's individually or in groups, that can help a lot. I just want to stress on one aspect of mental illness that it's usually a taboo to talk about. Two things: domestic violence and substance abuse. And we who came from the Eastern societies, we have a stigma to talk about these things. And these things need to be addressed, and need to be addressed and treated, and we should not shy away from that. And by the way, even in our society, here in Dayton, I know there's a lot of substance abuse in the community, and people are not talking about it. And there's a lot of domestic violence in the community, and people are not talking about it. Sometimes we have this sense of pride that we should not be like that, and that's very damaging. That if we face the problem, if we face our reality, and we have this sense of humility, we will be better. The problem, I always tell the students that the worst obstacle to learning and get better is actually arrogance. I always tell the students that who work with me, what's the worst obstacle to learning, whether learning academically or learning in life? If you did this way, or I don't deserve this, or no, I am bigger than that, or our families don't, we don't have these things in our families. Or what's worse than that, if we suppress our kids and we don't allow them to express their emotions. If you suppress your emotions and you're not allowed to talk about it, by the way, your body will hurt. And we have a group of psychosomatic disorders, we call it. And the psychosomatic disorders are actually psychiatric disorders and mental health disorders that's presenting as pure physical symptoms. your body hurt, your joints hurts, or you have headache, or you have pelvic pain. All of these things can be originating as psychiatric disorders. What's the mechanism for that? Why some people can have mental health symptoms and they don't express it, and they end up with these physical symptoms? There's a mechanism called alexithymia. You know what alexia means? To read. Like dyslexia means inability to read. Alexithymia means inability to read your emotions. That's it's in the explanation of this word, alexithymia. The people who are unable to read their emotions right, unable to connect the dots right. That means you're upset because of what happened this morning. That means you're angry at your husband, you're angry at your son, you're upset, you're depressed, you feel vulnerable, you feel insecure, you feel anxious, you feel threatened. If you don't identify these feelings right and you connect the dots, your body will go out of control. Very important for mental health are people, number one, to be able to identify their emotions right as it is. Don't hide it, don't sugarcoat it. And I'm talking about between you and yourself first, and then to other people after that. To identify your own emotions right is the basic of mental health, number one. Number two, the ability to express your emotions in the right way. The majority of people who are unable to do that, the people who are expressive and they express their emotions, and they can find people from the family or from their loved ones who understand their emotions and deal with it in a healthy way, that is the basics of mental health. The basics of mental health is to know yourself, accept yourself, and most importantly, to accept your own emotions. And don't be afraid to acknowledge it. I am afraid. I am depressed. I feel threatened. I feel threatened when I am in a public place. Or I feel anxious when I am around people because I feel insecure. And I feel insecure because I have some childhood issues, because somebody did something to me, because my father or my mother were strict with me. They were suppressing me when I was a child. This ability to express, and that's what we encourage in therapy, by the way. We encourage in therapy is people to express their emotions, to identify it, and learn how to deal with it. So what we're facing at this point is a lot of stress coming on us. Physical stress. We'll talk about mental stress. We'll talk about social stress. We'll talk about uncertainties about life. We'll talk about triggering past traumas that people had. The people who had traumas in childhood are now coming back. The people who had early losses in their life, it is coming back. And the loss is coming back, and the loss keep happening. It's re-experiencing of the trauma from the past. And we have to understand that all of these things, if not expressed and dealt with appropriately, will result not only in a lot of mental health issues, it will result in physical health issues. You will be interested in knowing that being alone, loneliness, by the way, there's a difference between loneliness and solitude. Solitude is healthy. Solitude means you're able to accept you being alone within yourself, accepting yourself. Loneliness means you cannot find anybody around you. So you're forced to be alone. You want to be around people, but either you don't have the ability to be around people, or you feel rejected, or you hate people around you, or you're not accepted by people. So you're forced to being alone. Loneliness actually cut our life expectancy. Loneliness cut our life expectancy. People who are lonely, they die earlier. People who are just lonely, they die earlier. And also there is a correlation between loneliness and physical health as well. Solitude is different. Solitude means you don't mind staying alone. You're still connected with people, but you're comfortable with yourself. There's a difference between these two. And during this pandemic, a lot of people felt lonely because their well-being is dependent on other people. And by the way, all our well-being is dependent on other people. We can't live alone. But being around people, it varies from one person to another in accepting themselves. How much are they comfortable within themselves? Some people, their emotional well-being is totally dependent on other people. And these people suffered a lot during this pandemic. The people who are self-sufficient emotionally, they can be okay with that. They can be okay and they still have this connection with people, but they are satisfied with ourselves. But the people who are always dependent on others to feel good about themselves, they might be struggling during this because they force it to be alone. When people are stuck in the house together, and that's what happened, a lot of pathology have emerged here because of that. Because in the past, people have different places to go. People are stuck, husband, wife, and kids are there all the time, can't go anywhere. And this created a lot of family struggle. And we see this all the time. And of course, even with the social media and the technology and the internet, it is not enough to satisfy us. We need the physical connection. We need the hug. We need the face-to-face talk. And I personally don't like these when we do Zoom meeting and Teams and all of that. And I always tell them that I can't wait for the day that comes where we can just meet face-to-face. It doesn't sound real. It's really not real. And I love to talk to people face-to-face. And I wish if we can, hopefully after the pandemic ends, maybe we can meet again and I see people face-to-face where we can interact. That human interaction, we missed it. We missed it a lot, and it affected us. The effect of this type of stressful situation on us varies from person to person. Some people were able to cope with it. Some people were less able to cope with this pandemic because we're genetically wired differently. And by the way, I just want to, for us, all of us, to humble down about knowing who we are. We are the product of three factors that we have no control over them. We are the products of our genes, we are the products of our brain biology, and we are the products of the first 3 years of our lives. Yeah. When I meet with the students in the morning, I tell them, you see these patients on the other side, the mentally ill patient, the drug addicts, the people who have problems, and then you see yourself. I tell them the difference between you and them could be just pure luck. So don't be arrogant, that don't feel that you're better, that you're not better than them. It's just a matter of pure luck. You're lucky. You have good genes, you have good childhood, and you have good brain biology. That's who we are. Some of us are more vulnerable than others. And something will hit from outside that activates this can of worms inside us, or this explosion inside us, and we have no control over it. And the best way to deal with this, if the stress is causing a lot of pathology and a lot of mental health issues, we have to acknowledge it and go and seek help for that. Yeah, my friends on Facebook are writing to me, what I say always, life is unfair and life is unpredictable. This is one of my famous statements on Facebook. Life is unfair, life is unpredictable, and that's the nature of life. And the other thing I always tell everybody is that forgive your past, forgive your parents, and move on with your life. If you want to pursue mental health, that's what you need to acknowledge. Life is unfair, and life is unpredictable, and you have to accept it as it is and move on. This philosophy of life, whatever you want to call it, will take you to the right path into recovery from your own issues. Don't blame yourself. The sense of guilt the sense of shame is very damaging to our self-esteem and our mental health. And I just want to say a short statement to the aspect of religion that could be misunderstood, is the sense that we could be punished by what's happening to us because of what we did wrong, because of the sins. I see this in a lot of religious people, Muslims, Christians, and everybody. Please don't connect it like that. I fully understand where is that coming from, but things sometimes just happen. Things just happen for no reason, and don't blame yourself for it. And don't always have this deep-seated guilt that when something bad happened to you, or you got depressed, or you lost something, or you're not doing well in life, please don't quickly connect it to what you did wrong in the past, because that becomes, after a little bit, a self-fulfilling prophecy. If you have the deep-seated guilt, you're going to make it happen, by the way. The self-fulfilling prophecy, if you're afraid of something and you believe in it too much, you develop something called selective attention. You pick and choose the things that's already predetermined in your head. So we have to be aware of that. So get rid of the guilt. We have to work on the shame as well. Guilt is an internal feeling inside us. Shame is we're afraid that how our picture will be in front of people around us. So shame is external. So we'll shame our parents, we will shame our family. We need to get rid of that. And we need to develop this sense of internal sense of control and sense of empathy and sense of understanding of the human mind, that we're all in the same boat. Mental illness is part of life. The people with mental illness, they did not develop mental illness because they did anything wrong. No, it could be purely genetic, by the way. We should not be ashamed of it. There is no difference between depression and diabetes. There is no difference between schizophrenia and cancer. There is no difference between post-traumatic stress disorder and asthma. Brain biology, one of them is in the software of the brain. The other one is in the hardware of the body. We always call psychiatry is the software. Psychiatry comes from the software of the brain. Neurology comes from the hardware of the brain. So if you have a computer, neurologists, some of my friend neurologists, I tell them that neurologists are the ones who fix the hardware of the brain. Psychiatrists, we fix the software of the brain. So that's the difference between neurology and psychiatry. The software of the brain is the mind, is the emotions, the thoughts, the behavior, the struggle that we have. And because it's not tangible, we don't have a blood sugar of 400 like the other doctors have. Our symptoms are mental. Our symptoms are software, like what you see on the computer there. So you could have a computer is working well, but the software of your computer is not working well. And that's why the picture or the program is not functioning well. Same thing for the mental health issues. The software of your brain is not functioning well. And there is treatment for that could fix it. And it usually comes from some subtle changes in the brain that came from the effect of the environment on some vulnerability on your brain that you develop the mental illness. We call it stress diaphysis model. If anybody wants to read about that. So there is a diaphysis, means vulnerability you have. The stress comes to that and results in an affect it and trigger it, and you develop the mental illness or the mental health phenomenon. That means if your diaphysis is 80%, only 20% stress can trigger a mental illness. If you have good genes, good brain biology, and your diaphysis is only 20%, you can tolerate stress up to 80%. That's why the variation in our brains and in our resilience, in how sensitive we are, in how we deal with the stress, it varies. So remember this equation. Your diaphysis means your vulnerability, which is your genetics, your brain biology, your early childhood, and then the stress you have. Yeah. For example, if I always ask the students this question, what is the incidence of post-traumatic stress symptoms 1 week after rape? And they tell me 90%, 80%. I tell them 100%. So if you get anybody who was raped and you check their symptoms 1 week later, 100% of them will have mental health issues, will have PTSD symptoms, will have post-traumatic stress disorder, anxiety, panic, re-experiencing of the trauma, nightmares. Do you have to be vulnerable to develop symptoms? No. If any of us have been exposed to this type of stress, why is that? Because this type of stress is 100%. You face this kind of fear and humiliation and physical violence and sexual violence. Anybody exposed to this type of stress will develop the mental illness. But if the vulnerability is too high, a minor amount of stress, you will develop the mental illness. So that equation is very important in assessing ourselves and also assessing why some of us can develop mental illness and some of us do not. It has nothing to do with your personality or your choices or what you did or whether you're a good person or a bad person. No, there are very bad people who don't develop mental illness. And actually, mental illness happen more frequently in good people. The irony is that sensitive people, caring people, empathic people are the ones who develop depression. And I always tell my patients that if you were a careless person, you will not be depressed. Other people will be depressed because of you. And we have so many examples of that around us. Narcissistic people, antisocial people, sociopaths don't develop mental illness. Who develop mental illness are the people who are caring, who are good people. There's also another book called Why Bad Things Happen to Good People. Why Bad Things Happen to Good People. The author of this book, I read an interview, I looked at an interview with this author a long time ago when I was still in Virginia, when I came to America. He changed the name of the book at the last minute. So he changed the name of the book from Why Bad Things Happen to Good People to When Bad Things Happen to Good People. Because he said, we don't know why. We do not know why bad things happen to good people. But the book is about when bad things happen to good people, what do we need to do to deal with it? But actually, bad things could happen to good people more than to bad people. So that equation in life, we have to correct a little bit, and we have to look at life and look at calamities and look at these stressful situations in a very neutral way, very empathic way. We need to connect more with each other. We need to understand each other. We need to humble down. Humility is very important. And if we have mental health issues, don't shy away from talking to yourself, talking to loved ones. And help is there, and help is available, and treatment might be actually much easier than you think and much shorter than you think. And actually, I will end by saying that we are proud as psychiatrists that the prognosis of mental illness, prognosis means the outcome of mental illness, might be higher than other specialties in medicine. That depression is curable, anxiety, even bipolar disorder, manic episodes are curable. You can easily end it. You can have maintenance treatment. A lot of mental illness, actually the prognosis of these mental illnesses might be better than many other specialties, like in medicine or surgery or things like that. So mental illness is treatable and it has a good prognosis. It has been 35 minutes now since I have been talking, and I will stop here. And I see if I have any questions, I'll be happy to answer your questions.
So thank you so much, Dr. Esam. That was an amazing, fabulous lecture. Dr. Esam, as Dr. Sarah said, is one of the founding members of BMS, and it is fitting that he is our first speaker. We could not have asked for a better start to our healthcare seminar series. So on behalf of the Healthcare Committee and DMS, thank you again.
Thank you very much, Dr. Aya. Thanks a lot.
Time and energy on a Sunday morning to spend so much time. I see a couple of questions on the chat box. So the first one I'm going to take says psychotherapy for treatment with medications of the person who is suffering from depression. Do they always need medication?
No. Moderate and severe depression, tell you the truth, moderate and severe depression medications. Medications with psychotherapy, mild forms of depression could respond to psychotherapy, yes. And also depression is not always a chronic disease. Depression could be recurrent, could be episodic. So the episode of depression could actually end and the person can regain their normal level of functioning just by the passage of time. We always say that time is the best cure. For mild forms of depression or for episodic depression, psychotherapy might be helpful alone without medications. Moderate, severe depression, highly recurrent depression, with history, when genetics are strong, I think medications are indicated.
So there is a comment / question. Lots of people thanking you for a very good discussion and talk this morning. So there are a couple of people who say that they're concerned about psychiatrists for carrying a lot of stress personally, having to take care of patients as well as other healthcare workers. And maybe, how are you trying to deal with self-care and trying to keep yourself healthy so you can, come up with all this energy to help all the patients you've been taking care of?
Right. The question is, thanks a lot. You're a very caring person who asked this question. The question about how am I dealing with these mental health issues during the pandemic? And definitely the whole, not just actually, it's not psychiatrists that suffer the most of this. In the mental health field, the people who are suffer the most are emergency room physicians and ICU doctors and internal medicine doctors. And those, I have seen a lot of stress on them. And unfortunately, we probably all have seen a case of suicide from an ER physician. Yeah, an ER physician who committed suicide. She was apparently a healthy person, married with kids, but the amount of stress she had in the ER, it activated something in the brain. And that ER doctor, who was a very famous and good doctor, ended up committing suicide. So the toll on the healthcare field, especially nurses, by the way, has been tremendous. I personally learned a long time ago to consider by the way, I teach my students there. Actually, a few weeks ago, I saw a medical student who was crying when she was seeing a patient after listening to the story. And I sat with her and I told her that in medicine, you're gonna see a lot of calamities. And I have seen in my life stories from my patients that I can make a movie about it. I have seen things about life, but I learned to realize that I will not be an effective psychiatrist if I take it personally. And I told the student that you will not be a good doctor if you take your patient stories personally. Medicine, psychiatry is a profession. It's a job, and the best thing to do well in that job and to help your patients is not to take it personally. And I encourage doctors who have problems from their job, the burnout, or it start to affect them personally, is to seek their own psychotherapy. And actually, in my residency program, we were required to do a 1 year of psychotherapy, by the way, and I did that, and it helped me a lot. So when I was a resident at VCU, and even here at Rice State University, we encouraged the residents to do their own psychotherapy. So I had my own psychotherapy as well, and that helped me a lot. But definitely the people who were not trained in this field, like ER physicians, ICU doctors, nurses, have suffered a lot of that. And I just feel really very empathic with people who work in that field. But for me, it's my job. I have seen a lot of disasters in life from my patient stories, that if I tell you, you can tell me, you know what, I'm grateful for what I have. But no, life is tough. And when I tell people that life is unfair and life is unpredictable, it's really unfair and unpredictable. And the people who understand that, they need to come and contact me personally, and I can tell them stories that really are just beyond imagination. But we have to cope. And thanks a lot for asking about me. I'm doing well, and I'm still able to do my job well.
I'm sure you are. There's a recent very hot topic in the community because a very unfortunate and tragic incident that happened just within the last two, where a young man, actually a medical student, unfortunately committed suicide in a well-known family in the area. The question someone has put up now is that depression in students is very prevalent, but often goes unnoticed. What are the signs that people around can detect and intervene early? If you, can help us all, give us some pointers that how in the great community we can all provide that additional support and, especially in this time which can be so isolating.
Right. I think what you did today is an example. The question is, what do we need to do to help people? It's unfortunate that this incident happened, and it happened in our community, and it's very sad that somebody ends his life. A very bright medical student does that. And that's what I said, is that actually very good people who are suffer the most. Bright people, intelligent people, they suffer the most. And because the standard are set too high, sometimes they don't complain. And medical students are very bright and very stressful college, and I fully understand. And all medical schools now are aware of that, and they are aware of the mental health of their students. But we need to educate our families and ourselves that with the early signs of depression, and especially when you see signs of hopelessness, I'll tell you, and I have been studying suicide for years, and I work in a hospital where we have suicide prevention program. And actually I made a Facebook video about a year ago about, it was in Arabic, so I do a lot of work to the people in the Arab world about suicide and predicting suicide. The two things that happen before the person attempts to kill themselves are an extreme sense of hopelessness and extreme sense of rejection. An extreme sense of hopelessness and extreme sense of rejection. If you study and you do psychological autopsy for people who kill themselves, you're going to find that the last few days before people committed suicide or completed suicide, they have these two things together, that there's no hope and nobody's going to help me. I feel alone. I feel rejected. And if we understand that, when I see these chronically suicidal patients leaving my hospital, and I work with veterans with high prevalence of suicide, and I have few patients I know they are at high risk, I sit with them one-on-one, not with the team, and I tell them, you know what? If you start to feel that moment where you're so hopeless, come to the ER and tell them Dr. A asked me to come, and ask them to call me at any time of the day, and I will admit you to the hospital for just one day. Just one day, and you will be fine after that. This is very important thing, that if you can give me just 2 minutes to talk about this, especially suicide. Nobody wants to kill himself. We all want to live, by the way. Suicide is not a normal phenomenon. It's something that happened in our brain that will be the only outlet, the only exit. That's it. Everything we're stuck. There is an interesting study about the people who jumped from the Golden Gate Bridge in California. The Golden Gate Bridge, they call it the suicide capital of the world. People who jump from there, the survival rate from that jump is very rare. So it's less than 1%. And people die once they touch the water, they have severe abdominal injury or head injury from that. There are like very few people who survived that jump. And somebody studied them. And they asked them, how was your feeling once your foot left the platform? All of them said, we regretted doing it. We regretted doing that. So even when the second after you jump, they regretted. They said, no, this was wrong. And those people who survived, if we can protect the suicidal patient from that moment only, that sense of rejection and hopelessness, they will be fine after that. Some of them may do it again. We know that. However, it's that moment, if somebody can approach the person and tell them, I am there for you, you're not alone. And that's what I tell my patients. If the whole world is against you, and I keep it in his head that Dr. A is there. They call me Dr. A in my hospital. Few patients, I tell them that. I tell them, you know what? If the whole world is against you, I am here still there. And I want him to remember that. And we do all these forms we fill and suicide prevention plan. And I tell you the truth, these things, we do it and it's good and all of that. But that moment, I do it for certain patients. And why I want to tell them that I will be the last one. If the whole world rejected you, come to me. I will admit you for just one day to let this moment pass, and things might be better after that. And that's what we need to do with each other. And to give people that sense we are there for you. If you're not feeling well, I want one person to be there for me. If the suicidal patient has that, you know what? They may go to that person, just that moment to pass, that day to pass, and they may regret doing it later on. Thank you.
I heard in another session, someone say that you treat it the same way as someone said, like they're having chest pain. You tell them to go to the ER so that you treat that acute event. And in the same way, if someone, if they can get through that acute episode, like you said, then, that needs to be treated like an emergency it is. And then, moving forward, they may be able to overcome it. So
that's true. That's true. It is an emergency similar to chest pain. Absolutely, yes. And they need to seek help. Yeah.
So we have a question here asking, how do we reconcile neuroscience and psychology, the notion of free will?
That's interesting. Are we going into a philosophical discussion? Okay, interesting. I may upset few people here. Okay, I will try not to upset a lot of people. The concept of free will is very complicated. It's very complicated, and I think may have disagreed. This will require a different session. Yeah, the whole concept of free will. Our free will is very limited, by the way, and I truly believe a lot of our religious thoughts about this area need to be reassessed. And if you want to invite me after the coronavirus to talk about this and have a heated discussion about it, I would be more than happy to come, because I'm interested in that. But this concept of free will does not exist. Free will is very limited, by the way.
All right, you're on. I think there's enough of an interest in our group, especially, and maybe in the larger community, to come and maybe have a bit of a debate.
Yeah, if you can get me somebody to debate me about free will, I will be more than happy to come in.
Okay.
But I have to tell you that I will destroy them in the debate. So
I come from the other side, but we would love to hear your version. And, everyone can kind of have their own self-debate.
Sure, yeah. If you want to have a debate about free will, I would be more than happy to participate, and get me the strongest person on the other side, and we're gonna have a good talk together.
All right, post-COVID, we put it on our list. I mean, kind of in a similar vein, I guess there's another question. Beside medication, how can we utilize our religion or belief in preventing or protecting us from mental illness?
Okay. Definitely, spirituality protects against major depression, but it doesn't treat major depression. We have something called protective factors. So we have something called predisposing factors, the diaphysis we talked about, precipitating factors, and protective factors. Protective factors is what gives us resilience. Resilience means that psychological strength that we have. So the family connections, our personality, our jobs, our loved ones, and also our spiritual connection. Studies have shown that strong spiritual belief system might protect us. However, we talk about the genetic determinism here. There is another study that showed that strong religious belief system, if associated with a deep sense of guilt, might predispose people to major depression. That if the religious thoughts, the concepts you have, the spiritual concepts you have, carry a lot of sense of guilt, and you have the genetic predisposition, that sense of guilt can predispose you to major depression. And I have seen a lot of highly religious people, that sense of guilt resulted in severe major depression because they started to blame themselves. So the relationship between the genetics, the personality, the life experiences, the belief system that we have is too complicated. But in general, strong, healthy spiritual connection with a higher power is helpful protecting mental health. That's in general. Within that general concept, there might be exceptions there.
I think that's as well. And I stand corrected. Sister Judy says we should have a discussion and not a debate, and that when post-COVID, so we will make it more of a discussion, inshallah. So
we'll talk about the free will thing.
Yes.
People like that one.
Yeah.
Okay.
So I guess they wanted to do a discussion.
Discussion is fine. Discussion is fine.
Yes. I think maybe one last question, because we are kind of over time already. So another one, again, like I said, there has been a lot of angst recently about teenagers and kids and their challenges. So this question is along the same line. What are the signs a parent should know about their child who might be struggling with anxiety, and when should we reach out for professional help?
Child suffering from anxiety. Childhood anxiety is common. Now we have to know exactly if it is within the normal development of the child or not, but excessive worrying, irrational fears about the child, obsessive compulsive symptoms in the child, excessive avoidant behavior in the child, inability to function in school due to anxiety, inability to function in social settings during anxiety, excessive crying, excessive attachment to the parents. All of these things could be a sign of anxiety. And there is a lot of beautiful child psychiatrists here available, and child psychologists that can evaluate the child. And the child may require some sort of psychotherapy or some sort of guidance with the parents about that. But childhood anxiety and also childhood depression has to be addressed, and there are treatments for all of this at this point.
Well, Thank you again. I think we had a great turnout. I saw 33 plus participants, so that's not bad for a Sunday morning. Again, Dr. Esam Alkhawaga has given so much of his time. So again, thank you again. Sarah, you want to add something?
Just wanted to thank Dr. Alkhawaga, and it was a wonderful talk. But the psychiatric ailment is such an extensive topic that I think we can talk about it for days and days together and still be not addressed. But inshallah, we'll definitely have you again sometime soon. And thank you, Alia, for moderating. You've done a good job as usual. And thank you all the attendees over here. Thank you for joining us, because that really gives us encouragement to do these events, inshallah, frequently, at least once a month for sure. But keep in touch, and we'll be bringing out another next session the first Sunday of April, inshallah.
Thank you very much. Thanks a lot. Thanks very much.
Thank you. Jazakallah.